Okay, answering your question about the walker. Okay, size of the walker. If I have the walker, if I'm standing in the walker as if I'd be using it, I should be, if I let go and put the hands down, then the handle with me standing tall should be about at my wrist. Okay, so this walker is about the right height for me. So looking at it from the side, if I'm standing tall, put my hand down, the handle should be about at the wrist. Okay, that gives your arms the right amount of strength to use it. Second thing I want you to know, based on what you told me, one leg is immobilized. If the leg is sort of in that immobilizer, stuck straight, it's going to be hard. The hardest part of walking is it feels like it's in the way, right? So I suggest getting rid of that shoe. And on the good leg, wear a thicker shoe. So a shoe on the good leg that is thick, it boosts you up a little bit. So a good running shoe, or just a nice tennis shoe that has a thicker sole, not like a zero sole, so that it kind of gives you a little bit of height on that good leg. Okay, then the sequence is going to be walker, foot with the immobilized leg goes in between the four legs of the walker, push down on the walker, bring the good leg width to it. Four legs of the walker, immobilized leg goes in between, but you're not touching the ground. If they're telling you non-weight bearing, you're not touching the ground, but you're going to put it there as if that's where you would put it. Weight goes through the hands, good leg comes into the middle of the walker. Be careful not to get your either foot too far in front of the walker. So in other words, you want your feet to always sort of be, never get in front of these 2 feet, the front feet. Because if my feet get either the leg in the immobilizer or the leg I'm using, if it gets in front of those feet, then it makes me feel like I'm going backwards, and that's what you don't want. So those 2 things, the height and the shoe, help a lot with being able to feel a little more confident getting around. All right, there you go. Let me know how it goes.